I've had all three of the most common skin cancers: melanoma, squamous cell, and basal cell carcinoma. None of them looked like the things that they usually warn us about. They didn't follow the ABCs. A is asymmetry, B is border irregularity, and C is changes in the color. So I wanted you to know it is important to be aware and watch for the ABCs. It doesn't necessarily look like the boogeyman they tell you to look for. I had melanoma on my lower back in my late 30s, and it just looked like a new mole, which I get new moles from time to time. It didn't look particularly scary. It wasn't really asymmetrical. It was a little dark. It wasn't black, but it was a little dark, which isn't terribly unusual. But I didn't think that much about it. But I go to the dermatologist twice a year for skin checks. It was melanoma. They had to do a surgical procedure to take it out. They go really deep and really wide, much bigger than the tumor, to make sure that they get all of the cancer out. Melanoma can become aggressive, and it's not necessarily as slow growing as the others, and so it can be deadly more quickly. Around that same time, I had a squamous cell carcinoma on my arm, and it looked like almost like a little bug bite, or like nothing. It's just a red bump. It wasn't a mole. It wasn't even the pearly color that they talk about sometimes. So I didn't think a lot of it. I did eventually have a little bit of a change of color. It stayed the same for months, but I did notice that sometimes when I was out in the sun a lot, that it would get redder and a little more irritated looking. Not crazy, but it looked like a really benign thing, but it didn't go away. For my squamous cell, I had to have a chemotherapy cream, and that made that go away. And then most recently with my basal cell carcinoma, it looked like a pimple that never goes away. Maybe a little bit tall for a pimple, tiny bit. I thought it was a clogged hair follicle, and it was a basal cell. And so I had to have a Mohs surgical procedure 3 weeks ago. I just got the staples out earlier this week. It looks a little better today because it's not as red and inflamed as this is what it looks like 3 weeks later. Skin cancer, it can look really benign, not necessarily like the traditional things they tell us to look out for. It doesn't have to be a mole. It doesn't have to be asymmetrical. And if you catch it early enough, there may be no changes in color whatsoever. I caught all three of my skin cancers very early, but if this is what skin cancer looks like when you catch it super early, you don't want to find out what it looks like if you don't. And despite the misinformation that you may have heard, skin cancer can kill you. Be aware of new things or changes on your skin. And beyond that, make sure you get your skin checked by a dermatologist every year because it could save your life.